Please remember, mute your mics. We do want to hear the noise. We do want to hear
Doctor,
private conversation between you and other people.
Doctor, is
The
there gonna be
beeping
a timer?
sound, I think the beeping sound is because of people entering the session. So please be prompt. So it's already 2 minutes after 12. You should have all entered before 12 so that we will start sharply at 12. So,
Doctor, I think the noises are coming from you since we're all muted because they're joining and the beeping noises are coming from you, I guess.
are what? From,
I
from the
know.
program? Okay. No, but sometimes I hear like private conversations. Like, I'm
No,
sure all of you have heard the conversation in the last lecture, right? So there might be some internal noise with the software, but we can reduce it if we all muted our mics. Okay, so without further ado, let me start. So the last part in the other lecture, which is Introduction to Anatomy, we reached where we said inside our body we have cavities, we have thoracic cavity, and we have abdominopelvic cavity. It's the abdomen and the pelvis. And of course, we have dorsal cavity, that is your skull and the vertebral cavity. Okay? Now, when we talk about the abdominopelvic cavity, it is both the abdomen and the pelvis. We have plenty of organs inside. To make it easy to describe them, we like to divide this cavity into quadrants. We draw two lines, one in the midline, the other horizontal, and we divide it into equal quadrants. So I refer to this. This is the left upper quadrant. This is the right upper quadrant, right lower quadrant, left lower quadrant. Why I'm doing this? To make it easy for me to describe the organs. For example, I say that the stomach is mainly where? It is in the left upper quadrant. If I ask you about the liver, for example, the liver is mainly where? In the right upper quadrant. If I ask you about the cecum, this part of the large intestine, we call it the cecum, and this is the appendix. So if I ask you where is the appendix, you say it's the right lower quadrant. So you see why we are dividing the abdominopelvic cavity into quadrants. And other thing that anatomists do, instead of dividing into four quadrants, we divide the abdominopelvic cavity into 9 regions. 1, 2, 3, 4, 5, 6, 7, 8, 9. How do we do so? We draw two horizontal lines and two vertical ones. When you learn more anatomy, you will know exactly the location of these lines. For the time being, we want to know that we divide it into 9 regions. Now, the names of the regions, I expect you to know. For example, let's begin with the top three. In the middle, it's epigastric region. Why do we call it epigastric? This is where the stomach is mainly is. So we call it epigastric. Gastric is a word that refers to the stomach. Here we have hypochondriac. What hypochondriac means? It means below the ribs. Below the ribs. So I have left and right. Umbilical region. Why? Because here the umbilicus is located, your navel, your belly button. And on either side, you have lumbar region. Lumbar refers to the back. It's your back. And when we go down, you have the iliac region or inguinal, the side of your lower abdomen. We call that area the iliac. And this is hypogastric. So if you look here on this side, you will see the organs and you can tell For example, this is the urinary bladder. Where is the urinary bladder located? It's hypogastric. And I send the message again. Please, all students, mute your mics. There are still people who are not muting their mics.
Doctor, I have a question.
Yes,
Why is it called the iliac region?
iliac. As you will know in anatomy, when you study more anatomy, you will discover that in this region we have a bone called iliac bone, and we have muscles called iliacus, and you have a canal called inguinal canal. So this is why we call it the iliac.
Okay, thank you, doctor.
So these names will make more sense to you as you will learn more anatomy. Let me start recording. Okay. All right. So let's go through here. So the urinary bladder is where? It's in the hypogastric region. Notice that the bulk, the main part of the stomach, is where? It's in the epigastric region. This is the ascending colon. This is the ascending colon. Where is it located? It's in the right lumbar region. Okay? Now, the last slide is where we
Doctor,
talk briefly. Yes?
you said the hypochondriac region was below what?
Below the ribs. Why do we call it hypochondriac? Because notice here, we have the ribs of the thoracic cage, and part of the abdomen is actually located below or deep. We will not use below, we will use anatomical term. So the ribs are superficial and the cavity is deep to the ribs. This is why we call it hypochondriac. Hypo means below, chondriac is a word referring to the ribs. Okay, these explanation of the name are not required for you. I'm just telling you them so that these names will make sense to you. What you need to know is to know the location of each of these areas, you see? So you know that here is the umbilical, here is the right iliac, etc. And these are the 9 abdominal pelvic regions. Now the last slide is where we're gonna talk about the medical imaging. So in the past, before they discovered these imaging techniques, if someone is complaining from something inside his body, in the abdomen, for example, they will do exploratory surgery, a surgery just to see what is going on. Now, these imaging techniques allows you to visualize body structures. X-ray, I'm sure most of you have taken X-ray. This is the most simple form. This is used when you have a fracture in the bone, for example, you want to see it. So X-ray radiographs, they are for visualization of bones. The CAT or the CT, now they call it CT, computed tomography. In the past, they used to call it computerized axial tomography. In this technique, we are seeing imaging of the body, but the image represent a thin slice of the body. So if you make a CT scan for the abdomen, you will have many images. Each image represent what? A slice. So it shows you the organ as slices. Remember the planes I told you about? Frontal, horizontal, sagittal, and parasagittal. So CT scans will create slices that are in the same orientation as the planes I told you about.
Doctor,
Yes,
CAT, we memorize it as CT or CAT.
it will not make a difference. Yeah, it's something easy, you know. CAT or CT are the same. Just know we are talking about imaging of slices of the body.
Thank you.
DSA, digital subtraction angiography. Angio means blood vessel. Graphy, so this technique is for visualizing blood vessels. So if you want to see the blood vessels, you use this technique. PET, positron emission tomography, this technique is used to see metabolic processes. You can take an image for the liver to see which areas of the liver is active, is functional. Sonography, this technique is using sound waves. So this technique is not harmful. So other techniques, they are using what? Radiation. So you can't use it with a pregnant woman. Sonography, you can use it with a pregnant woman because it uses sound waves. So it is safe. MRI, magnetic resonance imaging. This technique depends on using magnetic fields, and these magnetic fields will generate images of soft tissues. So if you want to look at the brain, if you look at internal organs like the liver, the stomach, you use MRI. Okay? Now, let
Doctor,
me stop sharing and
doctor,
upload the
doctor,
other
sonography.
lecture.
Doctor, I have a question.
If someone is trying to speak, I can't hear him. If
Doctor, I have a question.
you see, that's what I'm telling you. Private conversation heard in your room. Let me share. Now the lecture I'm sharing is introduction to physiology. So the lecture, our lecture is summarized actually in this. You see this diagram here in this slide. This is actually summarizing the lecture. In the lecture, I'm going to talk about homeostasis. Homeostasis, the equilibrium of our internal environment.